This is Clergy TV.
Welcome back, our viewers. This is Ask Your Doctor on Clergy TV, the home of empowerment. I'm your host, Murugi Muturi, and today I have with me Dr. Geoffrey Magada, and we are looking at cervical cancer. Dr. Geoffrey Magada, karibu.
Thank you.
So we stopped at where we looked at we were looking at cervical cancer actually. And now you told us about women. Any woman who is sexually active is prone to, can actually get cervical cancer. Yeah? So, and you said women above the age of 20 are mostly prone to cervical cancer. So again, now we come to the treatment of cervical cancer. How can we treat people with cervical cancer once you're diagnosed with cervical cancer?
Based on the associated factors, for example, we mentioned the human papilloma virus, we mentioned the multiple sexual partners. Based on those factors, then it means that women who are sexually active are at risk. And also based on the stage, we know that stage 1 cervical cancer is where the cancer is limited to the cervix. Stage 2 is when now it goes around the tissues around the cervix, but it has not reached the pelvis.
Yeah.
Then the stage 3 is when now it involves the pelvis. Stage 4 is when it goes to other organs further away from the cervix. So if we get it at stage 1 and 2, we are likely to get a cure from it. If we give the treatment modalities that we have. And we know the treatment modalities we have are surgery, radiation, and chemotherapy.
Yeah.
So stage 1 and 2, once diagnosed, the gynecologists are able to do the required surgery to avoid further spread. And usually we are likely to get better 5-year survival rate if we get it early. Then there is radiation, and then there is chemotherapy based on what stage. The more advanced the disease, the more difficult to talk about cure. So the more we do what we call palliative treatment. The other aspects of treatment are supportive based on how much blood somebody has lost. They need to have blood builders or blood replacement.
Oh, wow. That is interesting. So you mentioned chemotherapy and
surgery, radiotherapy, and chemotherapy.
So those are the most common forms of treatment for cervical cancer.
Right.
And now we have, I think we all know there is a vaccine that's said to prevent cervical cancer, and it's mostly administered in Kenya to young girls. And does the vaccine work? Can you actually vaccinate someone against a virus? Does it work? Does it help?
Thank you very much. Talking about prevention, the prevention methods that we have for cervical cancer, a vaccine is one of them, based on the fact that we know that HPV virus is associated with the cancer of the cervix. So we have a vaccine against HPV virus, but not against all the strains. The vaccines that we have are only against 2 strains. And so we have around, and we know that 13 strains of HPV cause cancer of the cervix. So it means we still have a number of strains that are not covered with the vaccine. But usually the vaccine that we have covers for the usual available strains, and therefore we are likely to prevent majority of the HPV associated cancers of the cervix. And so it's important that girls as from the age of 9 to 26 years receive HPV vaccine, all girls.
Wow.
And those that may have risk factors for cancer of the cervix and did not receive a vaccine, even if they were ages of 26 to 45, they could still benefit from HPV vaccine. So the vaccine is available. It's not to all strains. It is therefore possible that you could receive a vaccine and still be susceptible to cancer, especially from those other strains that the vaccine is not available. Other forms of prevention of cancer of the cervix include avoiding risky sexual behavior in terms of age at onset of sex, and also avoiding multiple sexual partners. We also need to know that even if a woman did not have multiple sexual partners but has a partner who has multiple sexual partners, is still at risk of developing cervical cancer. And it's for that reason that we are emphasizing vaccination to all. Even in some areas, men are being vaccinated.
Wow, against
HPV, yes.
Wow,
right.
That is interesting.
Yeah.
So I think at this point we have understood that though you can be vaccinated, but still you can still be infected with the virus.
Yes.
Later, even after the vaccination, because it only vaccinates against, you said, 3 strains of the
two strains
yeah. of the HPV.
Yeah.
So are there other forms of prevention, say lifestyle, exercise,
yes.
the diet we
yes.
eat? Can you tell us about that?
Like I mentioned, smoking is a major factor in causation of cancer of the cervix, and so women are advised to stop smoking and avoid multiple sexual partners, as I did say. In the earlier whatever, and also we need age at first sex. The girls must be advised to only have sex at the right time and in the right setting.
Okay.
That would help.
Thank you so much for that information. I think we are very much informed about cervical cancer. We have come to the end of today's session, and we are grateful that you are here. You've taught us a lot. Thank you so much, our viewers, for staying with us. Please subscribe on all across our social media platforms, and just to inform you now, we have an app for Clergy TV. You can download it on Google Play Store. That will help you catch up on all our programs, and especially because we are a home of empowerment, we keep empowering you and informing you on different topics. My name is Murugi Muturi. This is Ask Your Doctor on Clergy TV. Thank you.